Hi, I'm Dr. Jay Burness, and this is the first video in what I'm hoping is going to be a series of videos on our approach to the management of post-concussion syndrome. And from this point forward, to make things a little bit easier, I'm going to refer to post-concussion syndrome in this video and following videos as PCS. So I guess the best place to start is what exactly is PCS? Well, about 80% of all concussions will heal on their own with absolutely no treatment besides rest inside of about a month. So if you've got symptoms of concussion and it's been a month since the initial injury, then you've got PCS. And in my practice, the patients that I typically see have had their symptoms hanging on from anywhere from 1 to 3 years. So the symptoms of PCS are varied, but if I had to rank them in terms of the most common to the least, it would go like this: headaches, vision problems, dizziness, light sensitivity, sound sensitivity, nausea, brain fog, memory problems, and finally postural orthostatic tachycardia, or to shorten up that mouthful, POTS syndrome. And that simply means that the heart races when these people stand or they're sitting upright. So these people's symptoms get worse the more upright they are, and they feel even worse if they try to exert themselves. A lot of these symptoms are related, and that's because the areas of the brain that are involved are close to each other, and they share some common neurological pathways. Higher functions like memory and understanding, they live up in the cortex, while the older, more primitive functions like reflexes, balance control, and control of the organs live lower down in the brainstem and the cerebellum. Some PCS patients have injuries in one area or the other, but I would say that almost all of them have brainstem issues, and many have problems relating to both areas. Brainstem pathways are used in the control of vision and balance, and this is why so many patients have their symptoms aggravated by visual tasks and challenges. This is also why we spend so much time using sophisticated equipment like VNGs and sacudometry to carefully examine and measure eye movements in our PCS patients. Finding the specific problems with the oculomotor and balance control can tell us which pathways are involved and which exercises we need to try and bring them back to full function. So in the next video, I'm going to lay out some of the specific examination and testing findings we see that are at the root of many of the PCS symptoms. So stay tuned for the next video, and thanks for watching.